All right, 11, A+. Public Health, fiscal year 2018-19 billing and collection policies and fee schedules. Public Health Director, Mr. Jim Broughton. Welcome, Jim.
Thank you. And thank you for adding that grant in there for us tonight. There are two documents. They both were approved at last month's Board of Health meeting. One is our billing and collections policy, and the other one is our fee schedule. Our billing and collections policy was already approved by the board last year. There's only two changes that were requested by the state when they came and did their audit of our billing guide, and they are on page 11, and it's under our animal services and our environmental health policies. We had to put an explanation here as how we determine those fees, and we did that. And I can read those if you want, but I know you have copies. So those are the only two changes in that document that we made. If there are any questions about the billing guide, I'm more than happy to answer them.
Board of Health is unanimous.
Board of Health is unanimous at the last meeting. Yes, sir.
Any questions?
The document verification, Mr. Button, that's not changed, has it? That's the same document we've always required.
It's the same document that's required by the state in our
That's the state
contract. Yeah, the primary agreement addenda that we have with the state, that's actually signed by the chair of the board, requires us to have a billing guide and a fee plan in place, and then it be approved annually.
You get a motion to approve?
If you want to wait, you can do both at the same time. The second one is the fee plan.
Let's do this one first,
Okay.
since we got it here. We got a motion, Commissioner Shields.
Yes, sir.
The second, Commissioner Higdon. All in favor? Aye. All right, with the no wrong door.
No, this is...
No, the fee
sorry.
plan. Yeah, that's one part. This is the second part. Yeah, I'm sorry.
That's why I was trying to separate it. I'm with you.
The fee plan, which gets attached to the billing guide once they're both approved, there are only a couple of minor changes, and the easiest place to start is on the last page. If you want to look at the copies that you were sent have the changes in red. We have had a request from the community member to create an adoption fee specific to veterans. So we proposed that to the Board of Health at their last meeting, and they approved that, where we would have a set animal adoption fee of $35 for any veteran for a dog or cat. Currently, a dog is $65, and a cat is, where'd it go? No, it's $65 for regular adoption. It's $45 if they're already spayed or neutered. That's the one. The other one, which is, there are 3 lab fees that we have. We have requests from community members to do additional labs for our colposcopy that we do. 3 of them, one is a level 2, one is a level 3 pathology screening. The level 2 is $35. The level 3 is, level 3 is $45. And the other one is an IHC AB stain. If you ask me what that is, I won't be able to tell you. I just know it's a stain that they do in the lab. And that is associated with our colposcopy, and that is $110 for that fee. All of these fees were approved unanimously at the last Board of Health meeting. The rest of the fees in this document, which is about 12, 13 pages long here, were fees that have already been pre-approved by the Board of Health and both the Board of Commissioners as well.
All right, you got a motion to approve the fee schedule?
Based on the Board of Health's approval, I make a motion to approve.
Motion by Commissioner Higdon, need a second. Second by Commissioner Shields. All in favor? Aye. All right, so now we're on no wrong door. Sorry to get it.
Yeah, no problem. I'm sorry to bring this to you so quickly, or late, but I was trying to get to Commissioner Veal beforehand, and we never been able to connect. We had a community forum about a month or so ago, called the No Wrong Door Forum. From that forum, we synthesized all the information we gathered from the community and came to the conclusion that we probably need a systems navigator. That's the No Wrong Door portion of this, and I'll go a little more into this in a minute, but this is an evergreen grant. The grant is for approximately $60,000. There are some county matching funds, but they're funds that are already appropriated in the budget for the health department that currently go towards the mental health services that we provide. We're also doing this in partnership with Appalachian Community Services, who has an outposted licensed professional counselor at the health department who does behavioral health screenings and counseling for the clients that we see at the health department. So they have some skin in the game as well. And we're also partnering with East Carolina University. They are going to purchase telepsychiatry equipment and give us 3 to 4 hours of psychiatrist time a week, which is huge. And we'll be able to house that at the health department and expand capacity for telepsychiatry in the community. So in preparing to write that grant for telepsychiatry, we had this other meeting, and we've decided to try and pair the two of them together because there is that matching component. And because we have the matching component for telepsychiatry, you can use that to our advantage somewhat. But we have, between us, Appalachian Community Services, and ECU, about a little over $100,000 in the game, about 135 actually. And we're asking for 60 from Evergreen. There's 2 components to the grant. The telepsychiatry component would be that the individual that we hire through this grant would basically coordinate the appointments for that telepsychiatry, would set up the equipment, would introduce the patient to the telepsychiatry unit and the psychiatrist, and then they would leave the room. They'd have their visit and information to go back to the provider to manage their medications or whatever they're going to do, and then the person would put the equipment away. So this is really in about a day and a half a week time. The other piece of this that we're looking at is the no wrong door piece. From that meeting, one of the things that we were able to glean was that we really need not a care navigator, because you hear the term care navigator all the time, but a systems navigator. We need a person or a contact place with an individual who's well versed in the mental health system in Macon County, who can help direct people to appropriate services. So that if you have a problem, and it's either a consumer or a family member of a consumer, and you need to access the mental health system, it's the kind of go-to person. We're looking at it as similar to the Veteran Services Office, where we have an individual who coordinates and helps those people access the service. They don't get them to their appointments, but they help connect them with county transportation or whoever needs to get them there. They help connect them with whichever behavioral health or a mental health agency that they need to be connected with. But it's one individual well versed in the system. The rest of the personnel that work there or associated with that would be all volunteers with that office. So what I'm asking for is, I know this is a lot of information to dump on you at one time, but permission to go ahead and apply for, and when if the funding comes available, accept the $60,000 from Evergreen to go forward with this project if we can do it.
Mr. Chairman, this is just the first step in this initiative. You know, we would love to be able to do the Stepping Up program. The fact is, the Stepping Up program, we are going to apply for that grant also. We just don't hardly qualify. We can't cross every T and dot every I in the Stepping Up program simply because we don't have a treatment facility. This is what the No Wrong Door is mostly one of the first proactive things you'll ever see. It's trying to be proactive instead of reactive to help with a lot of things. Most of these families and the people that need the help, but also, it does have a jail preventive part to it if you can get to these folks in time. So, with the treatment facilities to send them to, and hopefully a lot of these folks can be, they can have community outpatient care instead of ending up in the ER for days. And that's the situation we're in now and have been for a long time. So the health department's done an excellent job. Who really done the work was those folks in that room that day. Commissioner Gillespie was there all day, and I think he can vouch for that. So those ideas, that's where these ideas came from, is the folks that was in the room. And but I do appreciate all the work, Jim, that the folks have done at the health department. But this is just the first step, and I think we'll be successful in getting the grants. And we'll be going to Raleigh next week to see if we can get more. So with that, if y'all want to keep it and read it for a little while, but we need to apply for the grant. The grant cycle starts.
It's now.
Is now.
Yeah.
So
The sooner we get it in, the better is what they told us.
and it took a while to. We had so much information that came out of the meeting. It took a long time to put it together, and so we had to have the facts right. If you read this about your county and some of the statistics, I think you'll agree that we need to be proactive somewhere, and this is one of the steps. So, Mr. Chairman, I don't know if we need to, if y'all need to read it over or study it, or.
Well, Ronnie, I feel like I had the privilege of being in that room with those folks. County manager was there, and to say that it was an eye-opening experience is an understatement. I left there with even more of appreciation for a lot of folks, including our health director and his group. I think this, while I haven't had time to review this, if it's what came out of that meeting, I think I agree with you 110%. That's the first step. And if we don't get started, we'll never get there. So I think it's a real issue for Macon County, and it's going to continue to be. If we don't get started, we're never going to get anything done.
Let me ask a question that came out of that meeting that day. Is there a monetary qualification for students, or I won't say students, to receive this help?
No. None whatsoever.
So if
This
person in the school system, a child that needs some help, some assistance here, there's not Medicaid, Medicare, there's not a blockage there?
Well, you have to think about this component as kind of it's the connector person. It's not what Appalachian charges or what Meridian charges or what a counselor, well, I don't think the counselor's in school. They may bill, I don't know. But it's not that component of where the people get billed for the service, so we'd have to come up with a rationale for billing the service. However, this person will know where the IPRS dollars are, what agencies have them, and who to make the referral to use that state money, hopefully to provide that service, and then it would be a service free of charge to that individual.
Okay,
That's the objective. This is a connection point. This is you got to look at it just like veteran services, and we keep using that as the example. They don't pay for services for each, but they connect them to the.
It's a tough system to navigate.
I think that's one of the things we've seen in education, students needing some assistance. Somewhere they don't qualify because of the family that makes too much money. Is that right?
Yeah, if they're beyond Medicare, Medicaid, and beyond the IPRS dollars, that could be an issue or a problem.
And I think we've seen that this problem just pertain to one group. I mean, it's monetarily, it fluctuates all the way through. But there's another group here that may not be qualified that need this help too.
And that came out. I think there were several things that came out in that community meeting that we had, the no wrong door meeting, around affordability of service, around connecting people with the service, around jail diversion, around opioid use and opioid programs, treatment programs. All of those things were identified. This is just kind of step one for us. Those other things we can try and focus on and tackle as we go forward, I think that was what Commissioner Bill was alluding to a few minutes ago.
I mean, some of those things we're going to have to, when it comes to payment, almost every provider now, the ones they see now, over 60% don't pay now. So
is it due to their income level?
No, they're destined. You know, that had nothing really to do to it. When you're talking about a student, there's other avenues to get reimbursement for a student that's even above Medicare and Medicaid. So, but this is just the first step, Ms. Shields, to try to get for somebody. I mean, you know how busy it is at my place with these folks. So this is the first step to get that. But if they need help to find some way to get them help. That's what this is all about.
And just to clarify, this is not creating a new county position per se. This is creating a grant-funded position that we would do the same way we do other grant-funded positions, which would be through the association, North Carolina Association of Public Health Alliance. I think it's NCAPHA, however they say it, but which is basically a staffing company. So these people would be run through that staffing company until we could make sure within a year or so that we could sustain it and figure out how to sustain it and keep it in place with either additional grant funding down the road, or we'd be back here having a conversation if it really works and we benefit the community.
And that's one reason the stepping up portion of the chairman is going to be so important. It'll be ongoing. And so we can get a commitment out of that for several years. And so, but it's just like Commissioner Gillespie said, unless we start, we can't go nowhere. So this is the first step, really. And so, but we are going to go after that monies too. So, and we'll be working on that.
Thank you, gentlemen, for attending. Want to go ready to make a motion?
Well, I'll make the motion that we go ahead and give the health department full permission to seek these grants as we begin this program for no other reason than to be proactive and not reactive in some of these situations for our families and people that need the help in our county.
Mr. Chairman, I'm enthusiastically second that. And just add one quick comment. I think it has pretty much gone unnoticed. And I think it's good to recognize that there's a lot of causes out there that deserve attention that maybe don't get the attention that they do. But it takes somebody to carry the flag, and I think it just needs to be publicly recognized as Donnie Bill. There's no telling how many hours he gives to this. I'm pitching this forward, and I'll say you thank you.
Well, yes, sir.
You helped me with an issue last night. All right, we got a motion and a second. All in favor?
Aye.
Thank you, Jim.
Thank you again, Jim, for everything.
Appreciate it.
Jim. That's the only copy that I brought. Share that.